I'm joined by Gerry Stoker, Professor of Politics and Governance at the University of Southampton. Gerry's internationally renowned for his work in democratic politics and governance and local governance, public sector reform. He's written a book, Why Politics Matters, which looks at democratic politics and challenges some of the naivety or political positions that are taken and argues that it's not so much disengagement with democracy as challenges in our political system. But most importantly, he's written the key reading for this week's session. So thank you, Gerry, for joining us early on a Saturday morning in the UK.
No problem, Brenton.
I just thought I'd start off with articles such as this. There's often a story behind them, how they came about. It'd be really interesting to know the narrative behind what drew you to write this piece.
Yes. Well, this is a very reasonable question. I hope that your audience will bear in mind that the article came out in 2006, but actually I wrote the first version of it in 2003. So you're asking me to think back 17 years. Yeah. And I can't entirely remember what was going through my head 17 years ago, but I do remember that the conference that I wrote the paper for that I was invited to was a conference which has set up as a challenge the choice between democracy in government and effectiveness in government. And they set them up as alternatives. You could either be more democratic or you could be more effective. And I think that the original stimulation behind me writing the piece was to really challenge that idea and basically argue that to be effective, you need to be democratic. And the basic work on public value by Mark Moore, I think established that point very strongly, that understanding your authorization environment, as he calls it, the way in which you get public support and legitimacy for what you're doing, is just as important for public administrators as understanding their operational environment, the actual practice of how you deliver services. And so connecting the two gives you a chance of delivering public value. So I think that a lot of the original motivation behind the piece was an attempt to try and reconcile the question posed at the conference, which is that somehow there was a difference between effectiveness and democracy. And it was to argue that to be effective, you need to be democratic.
I'll just take myself off mute. As you say, it's been quite a while since you wrote the piece. If you were writing it again now, how might it look different?
Well, I think that at the time, I wrote it in a way that was also designed to try and put into place other ways of constructing public administration. So the short answer to your question is, if I wrote it now, I think I'd be focusing much more on trying to explore and expand the idea of public value. But a good third, possibly even a half of the article, is taken up with a critique of two other models, the public administration model and the new public management model. Now, when I wrote the piece, perhaps criticizing new public management was something that needed to be done because it was the dominant managerial paradigm. And to some degree, it still is a very strong managerial paradigm. But I've already done a lot of writing and research which tried to point out a lot of its limitations. And one of its core limitations is that it had too sharp a split between the politicians as the people who kind of steered and the public administrators as the people who rode. Now, as we've just talked about, what the public value concept is it kind of slightly challenges that and says, well, actually, it's important that public administrators care about the construction of the steering as well as the construction of the actual delivery itself. So I think, if I'm honest, if I'd written something in 2020 rather than 2003, then I would have perhaps wanted to expand much more about what this new style of management would look like and how it would work. And I would have liked to have given a lot more examples of the practice as well.
It's interesting that 2020 has been the year of COVID-19, and here in Australia we've seen a situation where you might suggest that there has been breaking down some of the traditional barriers through the cessation of COAG and the National Cabinet. But equally, we've seen a lot of public value being decided by politicians and experts. So it's almost like we've got both extremes going on at the same time. I'm curious about your thoughts of how this particular, and I know you say in the paper it's a mixture of the different approaches. What your reflections on both the Australian context, which you're very familiar with, but also in the UK context, what sort of insight do you think it has in the COVID-19 context?
Yeah, I'm going to start the response to that by focusing on the UK context, partly because as a research team over the last 3 or 4 months, we've actually been gathering a lot of data on the UK case, both through focus groups and survey work, but also more general observational work. What I'd say is that the UK case really shows how the problem in the UK, if I could sum it up and pursue the theme of this talk so far, is there's too great a gap between the authorization environment and the operational environment. If I put it the other way around, one of the problems with the cack-handed construction of so many of the interventions in the UK, the non-production of protective equipment for medics in hospitals, the complete disaster of the management of care homes, the construction of an app to do track and tracing that completely failed, the confused and mixed messaging, which has actually become really just fodder for a series of comedy series in the UK, reflects an overweening centralism in the way in which the UK government, or particularly given that the devolved governments in Scotland, Wales and Northern Ireland headed off in different directions, but if we focus on the way that the UK government tried to manage the situation in England, they did so in a ridiculously centralised way, and they did so too far divorced from the operational capacity that could actually enable them to do things a lot more effectively. So, for example, with the case of the purchasing of personal protective equipment, they took purchasing powers away from local hospitals, who were all actually doing it quite effectively, and many of them constructed relationships with local businesses and also local communities in order to get much more effective supplies. In the case of the track and trace app, they decided to go for this high-tech super whiz, when the much more traditional working through local communities, local authorities, people who actually know the area, has proved largely more effective in many other locations and would have been more effective here. So for me, I think that the biggest issue is that we in the UK failed to learn the lesson of public value, which is you need to have a closer connection between the authorizing environment and the operational environment. I think my sense is, certainly in the first phase in Australia, there were adjustments made with some evidence of cooperation between the federal government and state level governments, and even local government playing a role too, which enabled, I think, quite an effective response, combined obviously with the advantages that Australia had in terms of relative isolation from the virus compared to the very strong experience in Europe and now, of course, in many other parts of the world. I think what's intriguing and what I'd like to know more about, but I don't understand fully, is why there appears to be a significant issue, particularly in Victoria, and what lies behind that. But I think I can fairly confidently say, in the case of the UK, that an overweening centralism led to an authorizing environment where people were making, decisions, but they didn't have any understanding of what the operational capacity was, or what the role to them were, or or who else might be able to step forward in partnership to help. In particular, it's an enormous source of frustration that local authorities, who still have quite a lot of capacity within the UK, and they've largely been screaming bystanders, as in, you know, we can do stuff. They have been doing a lot, but they could have done a lot more. And the other group that's incredibly locally focused and incredibly locally knowledgeable, of course, are the local general practitioners, the people who provide primary care within the UK. And GP surgeries have largely been left out of the whole process, which is frankly bonkers. And it's all about having an authorising environment which is too divorced from the operational capacity, which I think goes right to the heart of the core public value message.
I think it was interesting in the Australian context that in one sense you sort of look at that kind of unifying between states and territories and federal government around health. But in the case of education and schools, it was quite fascinating where the states and territories were rolling out their experts saying, no, we couldn't possibly go back to school yet. The federal government, who don't have responsibility for schools, and were quite clearly, I think, hearing from the public, a lot of people were finding it very hard to have their children at home and help them with their schooling and do their work. The Prime Minister and the experts, the educational experts and health experts in care were saying, no, there's no reason why you can't go back to school. So I think there might have been some politics at play where we can win some goodwill by making this call and it will have resonance in the public, but we don't actually have to do anything about it. So I think there was still politics at play in the Australian context, I think, as there always is.
No, and I'll just add that one of the other features of, I think one slight plus in the Australian system, if we take on board that politics is always going to be present and operational in any system, at least you have in Australia an established federal system. In the UK, because of the relative recent nature of the emergence of strong devolved governments in Scotland, Wales and Northern Ireland, it is true that large parts of the English Whitehall system still haven't quite got their heads around the fact that Scotland, Wales and Northern Ireland can do things differently. And there was constant complaints, and I think there still are, about total lack of cooperation and consultation between the four nations that make up the United Kingdom. You know, and maybe 40 years ago, when there wasn't so much devolved government, they could have got away with it. But in the context of a devolved system where they hadn't really worked out how they were going to cooperate with each other, basically, Whitehall was constantly in denial about the fact that the Scots or the Welsh or Northern Irish could just go and do something different. And it kind of, the situation now is that there are slightly different rules in every single part of the United Kingdom. And then I think the most recent material, because the government's messaging has, after the initial phase, has been appalling, I think would be the only way to describe it. I think I saw some figures suggesting that only about a third of the population understand any of the rules now, which is not really a great position to be in when you're trying to manage a pandemic.
One of the questions that are asked about devolution everywhere, but including in the UK, is about shifting responsibility away from the centre without necessarily shifting the control of the funding. And so, you know, that can be seen in the UK to the nations, but also to large regional, you know, cities, or through the city deals. And that can often be by making it local and making it technical, you kind of keep it at a safe distance. But with something like COVID, which is international and national, it lifts up the scale. Have you seen examples of strategies of blame shifting or management of how has it been managed as it perhaps has shifted, responsibility shifted away from the periphery and back towards the centre?
Well, yes, I think that there's no doubt at all that Whitehall and Westminster is going to have to own a large part of the decisions made in relation to the pandemic. So I don't think that they can blame shift much to Wales and Scotland and Northern Ireland, and it would be, in public opinion terms, quite a strange thing to do, because it's pretty clear that the Scottish and Welsh and Northern Irish people generally rather appreciate what their devolved governments have done. And let's just say that people aren't so automatically supportive of what the UK government has done. So I think their blame shifting strategy is going to have to be slightly more complex than that. And it seems to, I think, have three threads at the moment. One is they're trying to delay any inquiry. Oh no, we can't have an inquiry now because we're right in the middle of a pandemic. We've got to focus on dealing with the pandemic, etc. So there's a definite push for delay. There's a definite attempt to blame the scientists. Oh, we were only following the scientific advice, and then the scientific advice changed, so that's why we kept on changing. That's why we looked confused, etc., etc. So I think that there's going to be an attempt to push some of the blame onto the scientific experts that were advising them. And then I think the third thing they're trying to do is to blame members of the public. And they've chosen a favorite category of people to blame, which is young people who are behaving irresponsibly and not socially distancing, and just, they're an obvious cause of trouble. So, I think that's their blame avoidance strategy. But to be honest, I think what we know from wider studies is there's this phenomena called, after an American theory, called rally around the flag. And in the middle of a crisis, whether that crisis is caused by a pandemic or a terrorist attack or perhaps a tsunami or something like that, there's often a great surge of trust for politicians and for government in that time period, because people kind of have to have faith in something. There's this crisis, I can't control it, it's outside my ability to do anything about, so I look to another body, and that body is normally government or politicians to solve the problem. And what we saw was, in most European and North American countries, and indeed in our survey work in Australia, a surge in trust of support for both politicians and for government itself. But what we saw is that surge was virtually non-existent and disappearing when it came to President Trump in the United States, that it disappeared very quickly in the case of the United Kingdom government, that strangely it lasted much longer in the case of the Italian government. And in the case of the Australian government, it's lasted, but it's beginning to fade now. And what that tells us is that kind of emotional surge of trust, oh, I need somebody to help me in this situation, is then tempered ultimately by a judgment of competence and performance. So people are already making their judgments about the incompetence of the UK government. They have already clearly made their judgment about the incompetence of Donald Trump in the United States. In the case of Italy, the Prime Minister there, Conte, was seen as a much more effective technocratic Prime Minister who actually helped deal with a tremendous problem in Italy itself. And in the case of Australia, I think that the initial phase seemed to be incredibly successful, but as people begin to explore what went wrong or is going wrong now, then maybe some of the positivity will fade quickly. So I think that going back to the kind of underlying question, it's difficult for governments to entirely avoid the blame for what's going on, because most members of the public don't wait for a public inquiry. They're already making up their minds. And in the case of the UK, just to very quickly finish off, we did some focus groups, and they already show that there are at least 2 or 3 moments where people have decided that the UK government was hopeless. The first is there's this particular speech that Boris Johnson made where it was a very confusing speech, where he was trying to get people to come out of a full lockdown, but not come out of it completely. But the way he expressed it became a comedy sketch, because it was kind of, you know, go out, but don't go out, catch a train, but don't catch a train unless you have to catch a train. Go to work, but don't go to work unless you have to go to work, and then you can work from home. And you actually got people in the focus groups, people actually repeating it like a comedy sketch, and everyone else rolling around laughing. The other thing that had a massive effect was the Prime Minister's special advisor, Dominic Cummings, breaking lockdown rules. And people are just seeing that as a trigger for everyone else saying, well, if he's not following the rules, I'm not following the rules. And that's many people's explanation of why we have problems now. And these stories are kind of like embedded now. They're like repeated stories. They're like those family Christmas stories that are retold, and no one can ever really remember whether they're true or not. But, you know, they're part of what is the narrative. So I don't think government's going to entirely escape a blame scenario, because it's actually being constructed at the moment in people's heads.
You've described political and democratic and institutional disengagement or disillusionment. Is it an overstatement to say that public values management might be a key mechanism for public and policy leaders to reinstill some trust?
Well, I certainly think that that's the $1 million, perhaps we ought to make it more expensive than that now, $1 billion question, because what we know, I think, from a lot of trust research is that trust is quite easily lost, but not quite so easily regained and sustained. I do think that public value management could be part of the answer. I think constructing a much more engaged and effective conversation with the public about what public services and programs can do and what they can't do, what they can deliver, what they can't deliver. Even constructing a conversation about the understanding of the problem and what the nature, therefore, of solutions could possibly be, is bound to be something that in the end builds trust. And if people can understand also the connection between developing a set of policy goals and the complexity of actually thinking of how to put them into operational practice. Again, it's the kind of naivety in understanding that people have, you know, well, the government said it was going to do this and then it didn't do it. And I think that if people kind of reflected on how difficult it is in their own lives to have goals and then achieve those goals, they shouldn't be that surprised that governments don't always meet those goals. So if public value management could both have a role in giving people a real sense of engagement and control over what it is those goals are, that would be great. And if it could also give them a more realistic understanding of how difficult it is to achieve those goals, that would also be great. And if you had those two in combination, then I would guess that that would help to build trust. But one of the honest answers I want to give, Brenton, is that we have got this project called TrustGov, funded by the UK Economic and Social Research Council, which is a comparative project. And we're halfway through. I hope in about 2 years' time, when we finish the project, I'm able to give a slightly more clear-cut answer, because one of the core goals of the project is to try and discover what it is you might need to do to restore trust.
Thank you. One final question, very generous with your time. The participants in the course, many of them are experienced public servants and public service leaders. And you have extensive experience with the civil service in the UK and with the Australian public service. In the article, you talk about the skills of deliberation and the skills of delivery, and these being essential skills. So I'd be really keen to hear about, so what does that mean for today's public service leader, how do they develop those skills, or what should they be thinking about to take this from an academic paper to a valuable resource in their day-to-day context?
What a good question, Brenton. I love the group to discuss that. As I said, if I'd written the paper in 2020, I think I might have focused much more on trying to answer those sorts of questions, because they are by far the most relevant and important questions, and they're ones that I didn't really directly address in the article itself. So let me have a quick go now. I think that in terms of the skills of deliberation, I think it's about learning to listen to what it is that actually people are really saying to you. And I think that too much of media training, too much of advice that's given to public officials is all about getting them to be good at broadcast mode, about getting them to be better at explaining what it is that they want to do. And I think the core skill that's missing, both as far as I can tell in the UK public services often, and often I think in the case of Australian public services, is that skill of listening. Because listening also shows something else which is absolutely vital, which is respect for the views of others. And I think that if I had one thing I'd like to write a paper about at some time, it would be the skills of listening in public service. On the delivery side of it, developing that capacity for delivery, I think above all, again, if I had one core message which I would want to expand on, it's that no delivery solution is an island. Or if I can express it in slightly less poetic terms, reflecting John Donne's famous "No man is an island," the reality is that any solution is unlikely to be entirely produced within the public service. It's going to have to be produced in cooperation with civil business partners, etc. And it's that capacity to construct a partnership arrangement that is sustainable in the long run, which isn't simply just a shotgun marriage bought out of you throwing a bit of money around. I think recognizing that solutions actually require long-term partnerships and recognizing the different contributions the different people are making, which is you're not providing the solution, you're facilitating the emergence of the solution and its delivery through a range of other partners. So I think you put your finger on a core weakness of the paper. I've had a stab at trying to provide an answer, but I hope that the group can take it a bit further.
No, look, we certainly will in our discussion, and I think the fact that we're still talking so constructively about the content of the paper shows its significance and its influence, and there's not a lot of weaknesses. So look, thank you very much. Thank you very much for your time, and appreciate the contributions that you're making to this course. Thank you very much.
Okay, and I look forward to being out in Australia. When I'm going to get there again, who knows? But I look forward to visiting and seeing everyone in person soon.
Great, thank you.